Good afternoon, all, and Happy New Year. My monthly report, of course, is in board docs. A relatively slow month in December, usually always is for us, but one of the key things that did take place, of course, was the 5th Annual Drug Summit. We had quite a few staff from the health department there, and I also included, as part of my packet for you this month, a copy of the actual 2017 Jackson County drug-related data report that was prepared through a data committee that organized through the health department of multiple partners in the community. And I'm not going to spend a whole lot of time within this report, but I'd be happy to answer any questions any of you might have concerning the content of this report.
All right, Richard, thank you. Okay, committee members, you've had an opportunity to look this over. Anybody have any comments, questions for Richard? Anyone else? Apparently not.
Dr. Tompkins?
Oh, Dr. Tompkins, excuse me.
Yeah, I read your report, okay, and so on, and your conclusions at the end. What's your game plan in regards to this?
Yeah, well, I think that our overall plan from the health department perspective has been to, first of all, continue to maintain this report going forward and to create a community dashboard, if we have the resources to do so, on a county level that kind of tracks some key important indicators from this particular report itself. But overall, we need to continue the strategies that have been put in place through the various committees and work groups of the summit itself, the task force, if you will, that's chaired by Jerry Jarzinka. So we're a participant in a number of those particular work groups, prevention, medical, and I think also I'm on the steering committee. So I think we're going to continue many of the strategies that have been put in place, and maybe we don't really have a document that summarizes that very well for us at this point in time. I know that Jerry and his staff are working on doing that. One of the things that you may recall that we tried to put in place here in our community was through an application that we made to the Blue Cross Blue Shield Foundation for a Taking Action on Opioids grant that would have allowed us to actually create a harm reduction center here in the community that would both provide resources to support those who have an addiction, but also the primary objective being to get them into treatment and recovery. So we're still very interested in moving that kind of a effort forward here in the community. It's just a matter of when we can identify the resources to do it. So that's for the health department.
So I saw all the great data that you had there, white males between
Right.
20 and 40,
20 and
and
45.
so on, and how it's increased and so on. And it's usually the heroin, okay, and the fentanyl, the cofentanyl, and so on. Not so much the Oxycontin and the codeine, okay, and oxycodone. So you take away the pills, and you have which is given for medicinal reasons also, and now you're left with the illegal substances,
Right.
okay, which is making people die. So great data, okay, but I missed the thing at the end in regards to how you're going to attack that problem, okay, and so on. I mean, good data,
Yeah.
but I was looking for the final chapter of the book that tells
Right.
you, okay, who kills who, okay, and
You did get it, right?
I was left blind.
Fair assessment. Well, we have been a little concerned that most of the effort that has taken place from the funding perspective so far, even from the state level and from the federal level, has not been focused on the prevention piece. And we would really like more resources to get out in the community and to tell what this problem looks like and to help people connect up with services and resources that they need. At the same time, what we understand is that there's actually a capacity issue in the community. We don't have enough substance use treatment and recovery facilities here in Jackson itself in order to help the number of people that we're seeing that are coming through with overdoses and those, unfortunately, that are passing away as a result of it. So
The feds and the DEA had just passed something that they're going to be monitoring doctors, okay, to try to get rid of the doctors who are
Right.
just running pill mills and so on. So when they have to use their DEA number, okay, and so on, and they see that so-and-so is prescribing 4,000 oxycodone, every 6 months, then they're going to go take a look at them. So that is something from the feds, which is coming down, that they're going to do.
Right. There has been some funding to help support improvements in, I'm not a user, so I wouldn't know what they look like, but the Michigan Automated Prescription System, maybe you're familiar with it. So that has been a step in the right direction to help identify patients who might be potentially looking for opiate prescription drugs from more than one physician. So that's an easy way to monitor that, I guess, if you're using that system. So that's one way. Obviously, law enforcement is another group of the task force, and they're working together as effectively as they can, as far as I know, in terms of coordinating their response to it. But I think if you talk with any of the law enforcement chiefs in the community, they would all say the same thing. We're not going to arrest our way out of this problem. It's going to take more than that. So we'll continue to update you and report on the work of the summit as we understand it from our perspective on the public health side. But I think it's helpful to have maybe other updates on the other strategies come to the Human Services Committee or other committees of the county board as you may see as appropriate to update you.
I'm a full cause and effect person, okay? I'm interested in why the 22 to 40 or 45-year age group all of a sudden has that spike, okay, of addiction, okay, and overdoses and deaths and so on. And it'd be nice if, and I know you can't do it here, but if a big regional area could find out the
Yeah.
cause, whether it's depression.
And I agree with
or
you.
it's
Yeah.
unemployment or something else.
I think it's a combination.
Yeah.
It usually is. But you're right, that is one of the things that we identified in this report as a result of the work too, is that the next version of this needs to be a little bit more risk-specific in terms of rates, because those make it easier to calculate risk and to compare groups. But I agree with you, we need to have conversation on a more comprehensive basis with that age group that's experiencing the problem the most, and find out what can we do to turn this the other direction. So thank you for those questions. It's great questions.
Okay.
As far as my report's concerned, I also included a one-pager description for you of the priority areas that have been finalized in our health department's strategic plan. And just want to let you know that we're going to be working on these, beginning with the number one priority. We've already had a couple meetings at the health department looking at the agency infrastructure piece, if you will, in our own public health practices. So we'll keep you informed as we move along through monthly reports on where we're at with implementing and addressing the various portions of the strategic plan. On the resource front, if you will, I believe it was very early part of December, Julie Weisbrod, our Healthy Communities Coordinator here in the Health Department, worked with Christian Pluta to complete a grant application to the Michigan Health Endowment Fund. This one was focused on nutrition and healthy lifestyles, but there are multiple partners within the community organizations that also worked on this, and we're really excited. This is $500,000 over a 2-year period, and if we're successful with our application, the county would implement a first ever Healthy Choices initiative, and the city of Jackson is the focus, as well as other income eligible entities throughout the community as well. So I think it has a potential strong potential of achieving significant long-term impact by providing evidence-based nutrition and physical activity programming in the community. So we're hoping we might get selected for that. Other good news, Western High School, the district, if you will, but primarily focused in the high school, is now providing its students with comprehensive sex education for the first time in a lot of years. We think that's a really good thing for them to be doing. It isn't just one thing, again, that helps make the difference, but these are our teen pregnancy prevention coordinator taught 3 sessions on contraceptive methods and care to the school's 9th grade health class. So that's a significant step forward, I think, for the district, and we're pleased to be able to be a part of that. A quick update on hepatitis A. As of December 13th, there were a total of 601 cases of hepatitis A associated with the Southeast Michigan outbreak. It's about 640 now, so the number continues to grow. And just so you're aware, Michigan is the #1 case count state so far for this hepatitis A outbreak. As of December 13th, there were 501 hospitalizations and 20 deaths. We had 2 recent cases here in Jackson County diagnosed, but they're not part of this outbreak nor this outbreak strain. So it's kind of interesting. All around us, if you will, we have had counties with 1 or 2 cases of this particular strain, but for some reason, we're doing such a fantastic job here in Jackson County, we don't have any of the cases from the strain. I'll take the credit. Yes, sir.
I had read, I forgot where, there was one case in the area that was traced back, okay, to the same strain that was down in Detroit, okay? And it's coming from Chicago and it's coming from Detroit, and we're going to get it. And it's not it's not a bloodborne thing. I mean, it's not needles.
Right.
Okay, it's done with addicts. It's fecal oral, okay, is how the transmission is. And most people in sanitation departments or water departments are vaccinated for it, okay? They have a big epidemic out in San Diego because the homeless have no place to defecate, all right, because they don't have facilities. And so they're bleaching the curbs and the sidewalks and so on to try to clean it up, all right? So my question to you is, what would be the cost, okay, per vaccine, all right? 2, 1, do our first responders, okay? Police, firemen, you know, and so on. And if based upon that, is it cost effective to do that and then offer it to the general public? All right, because you have a vector, okay, you have a contagion, all right, and it's coming this way from the right and the left, okay, and so on. People work in restaurants, okay, it's fecal oral. One person contaminates something, they take it home, they eat it, their family gets contaminated, they go elsewhere. Nobody washes their hands that much anymore, okay, till they see another bad movie, all right, and then so I just think that you know, it costs over $1 million for a liver transplant, all right? And if it costs $5-6 to vaccinate somebody, it's cost effective and a lot cheaper in the long run.
We've actually had conversation and communication with the sheriff department here locally in the county. There was some interest, at least initially, I don't know where it's at right now, from Sheriff Rand to vaccinate his deputies and road patrol staff. The estimated cost for that at the point in time that we were talking about it was about $6,400. The vaccine would have to be purchased from the private market. We don't have any vaccine at the health department that is provided by state or federal sources that could be used because we're not an outbreak county. So that's just one indication.
You're right in the middle between 2 outbreak counties.
I know that, but the rules are the rules that they have put in place for use of CDC-provided vaccine. But the vaccine is available to the general public as well as to our employed first responders in the community through their normal health care source if they choose to receive it. And usually it is covered vaccine. So they can get it that way even if we can't necessarily get a low-cost option available here through the county health department.
I mean, I just remember the days of polio and so on back in the old days when you had to, you probably remember too, taking your little sugar cube
Right.
and so on. And people were in the iron lungs and so on. Okay, and those days are gone because we wised up and we started vaccinating people. Okay, and so on. So I'm just saying that there's a hurricane coming, all right, and we're not preparing for it, and we're going to get devastated by it. That's how I look at this.
The vaccine that we do have available through the health department is categorized as a vaccine replacement program. It is provided to us free of charge, but you either have to be an adult who is uninsured on Medicaid or have some other qualifying factors in order to receive that vaccine from the health department. That's what we have available right now. I mean, vaccine could be offered on a more general basis to the public. at a reduced cost if that's what the board wanted us to do. If you wanted us to buy more vaccine and make it available, that's a possibility. We just have to have the resources to do it. If we want to be a little more proactive on the preventive side.
So the ambulance people don't get it as of now, the firefighters don't get it, and the sheriff's department don't get it.
At this point in time, the recommendations that we're functioning under for hepatitis A vaccine is that in outbreak counties, they are recommending at least that first responders who are caring for people in an institutional setting, people that are incarcerated, et cetera, like that, they are recommending that they be vaccinated. And that's kind of where it's at right now for us in the county. Like I said, if there are resources available, we can vaccinate the sheriff's department or anybody else that you would want us to vaccinate.
May I chime in? I'm just curious as to why, is there a downside or a side effect, or are we strictly talking about cost, why they don't recommend additional people have it?
Well, putting aside for a minute the outbreak situation that we're dealing with in southeast Michigan, the general recommendation for hepatitis A vaccine is for travel by people to endemic locations in the world where hepatitis A transmission is actively occurring. It's also recommended for young children because if you do have, say, for example, in a child care setting, a worker who comes down with hepatitis A, source regardless, if you will, has the potential to spread that to children. In a child care setting, it will spread very rapidly because of the fecal-oral route. So in general, it's not a required vaccine for childhood age immunizations, but it is a recommended vaccine for them. For first responders in general, they're not considered to be at an increased risk above the general public, in the absence of an outbreak. So that's kind of the recommendation that we function under when we're looking at CDC's recommendations for vaccinating people against hepatitis A. But the cost is, well, the last time I checked, we could get a dose of the hepatitis A vaccine for $36, and we charge just a $20 admin fee. So that would be the cost to us purchasing it on the open market. And usually it's a 2-dose vaccine, but in this particular time frame, MDHHS is recommending getting 1 dose into people that are actually at risk because it's 95% effective at 1 dose.
Okay. Anything else on this?
Nothing else I have on hepatitis A.
One last question.
Go ahead.
If we were to vaccinate our workers that we feel are at risk, how long does the vaccination last? Like they say, tetanus 10 years. Is Hep A good for life, or?
As far as I know, it's good for life. I don't believe there's a booster requirement right now.
Could be a one-time expense.
Yes.
The real problem comes in people who have pre-existing liver disease, okay? Then you have somebody who has a mild form of hepatitis, some other form of hepatitis, or alcoholic hepatitis, or scarring, or pre-existing disease. Those are the ones who are really susceptible and get really, really sick and ill, and sometimes don't make it.
Yeah, and actually, people with liver disease is one of the groups that's recommended to receive this vaccine as well. If they haven't already, they should.
Thank you. Go ahead.
Thank you. The other item I had in my report was just a quick update on the Zika virus mosquito surveillance and community support program funding. You may recall that last summer we actually had some funding to support paying an intern from one of our universities to actually conduct a mosquito surveillance program in the community with trapping. Don and his staff oversaw that effort, and it was funded at least for the 2017 summer season. You can see from my report, I think the advantages that we achieved by being able to do as much trapping as we did across the state. 42,000 mosquitoes collected and identified, 3,500 trap nights. I think it's good for us to actually know that we didn't find the Zika virus in any of the mosquito pools that were trapped and collected in Michigan. But unfortunately, it looks due to federal budget cuts that at the CDC, we won't have the resources to do that again this coming summer. If something should change on that and we're able to do it, we'll let you know. We do have the equipment still available at the health department to reset the program up should people want us to do that.
Wasn't it last year that we didn't have the ground freeze that much, therefore we had a whole bunch of bugs and mosquitoes during the summer, whereas now they're all dying?
Well, yeah, we're freezing them pretty good this year. We did have a mild winter, obviously, last year. It's hard to know for sure what you're describing as being the case. All I know is that this is the amount of mosquitoes that we collected. And last summer, we also had a really pretty robust tick population as well. So they probably go hand in hand. That much we do know. Yes, sir. Nothing? Okay. And pretty much that's my report for you for the month of December. I'm happy to answer any of the questions you might have.
Anything else? Well, very good discussion, very good reporting. Thank you, Richard.
Welcome. Thank you.
2017 Animal Shelter fourth quarter and annual report. Don?
Good afternoon, Commissioners. Hope you enjoyed the last weekend of extremely cold weather until the next weekend comes. So at any rate, I do have my annual report here with the fourth quarter numbers as well. I won't get into too many of the details. You have it in writing, but just point up a few highlights. I'm sure you probably want to get to the Lenawee County situation would be my guess at some point. But in 2017, we did conduct Dr. Anderson teaching the euthanasia by injection course, and in fact she's currently, as we speak right now, conducting another course at the health department. We have about 19 folks over there from various parts of Michigan, including Grosse Pointe, Grand Rapids, Bath, Michigan, trying to do it from memory, somebody from Montcalm County as well. So there's a pent-up need out there for ACOs and various other professionals to get certification for euthanasia. So we are providing that. We're getting good turnout. We do charge $100 per attendee, so it is covering our costs and then a little bit. So we're good there. We are getting a better handle on our volunteers. We have a greater need for volunteers these days. We have a badging system as well as a whiteboard dedicated to the volunteers to put notes up there, so we're getting that communication flow going a little bit better. We, as I've mentioned several times in the past, we have the Animal Response Stakeholders Group that has been meeting on a fairly regular basis. We actually have two prosecutable cases right now. There is a court date for Zeus, the dog, sometime this week, later this week, and that's going to be moving forward. We have another dog by the name of Hugo. No date has been assigned to that particular case, but we're trying to get better communication between the law enforcement, human service agencies because of the possible link between child domestic violence as well as animal abuse. Okay, there is a link there. And so that was the initial purpose of the stakeholders group, but they're also just trying to get law enforcement involved too. Yes? No. But that will probably come up in conversation a little bit later. Because it didn't go away. Our commercial washing machine is operational in 2017. Want to thank the Friends of the Animals for the Jackson area who got that rolling a fairly long time ago, but it eventually got in place, and definitely want to thank them for coordinating that. The cat habitat addition is shelled in. The mechanical is in place. The windows are not. The cold weather, I think, kind of put the subcontractors on hiatus for a while, but that's about all the information I have. I'm not actually in the loop on that. That is a Friends of the Animals addition. They're the ones that hired the contractor, and they're the ones that are going to turn it over at the end of the day. So that's that situation. We only took part in one Bissell Corporation Empty the Shelters event. We were going to do the fall event, but unfortunately we had a outbreak of cat distemper about 2-3 weeks in advance, so we canceled it out of safety and prudence. We have every intention of doing it again in the spring. It's a very successful event. Bissell Corporation pays the adoption fees, and we can, the previous 2 or 3 times, we've moved anywhere from 50 to 75 animals out of the shelter in one day. So it's definitely a key thing. I brought in Jennifer Blau twice this past summer and fall from Deepwater Counseling just to provide workshops to help with stress levels, decompression, compassion fatigue. Planning on doing that again in 2018. We had animals in the field workshop. This was geared toward law enforcement and human service personnel. And we did actually tape one of those sessions, and we're trying to get it edited down so that we can actually provide that to law enforcement agencies and as a more effective way to get the information to the officers in the field. Obviously, it's hard to get any officers in numbers to these type of workshops just because of time and salary and cost and what have you. So this might be a more effective way where they can do it on their own or do it within their own shop and view a video. We partnered with YMCA 2 or 3 times this summer. We had a large bus load of 10 and 15-year-old kids coming by, getting some education about what the shelter does, helping out, providing us with a little free labor, if you will, and doing some other tasks. And we're planning on doing that again in the 2018. I brought in Ingham County Animal Control Officer to do some dog handling training. They're going to come back in end of this month, February, for a refresher course, as well as dealing with some cat training. And as I mentioned, the cat distemper kind of canceled out our fall Bissell event, Empty the Shelters event. You have a list there of some of the key events. As you can tell, we try to get out into the community. Summary of key events. For instance, we worked with Jackson County Library out at the Airport Road Branch event. We have gone into schools in the past, and we plan on continuing to do this. We hosted the Lumen Christi Day of Giving event, and then this, just before Christmas, we worked with the local Nissan dealership where they sponsored 10 dogs to get adopted out. So they'll be getting a thank you card. Apparently the manager or the owner of the Nissan dealership is heavily into dogs, and he approached us, and it wasn't hard to adopt the 10 dogs out free of charge, essentially. So the final page, basically your numbers, your statistics. The bottom line is we did about 2,300 dogs and cats in 2017, which is 164 less. But the key thing is our live outcome for dogs remained at 90%. which is a great thing. The rule of thumb in sheltering is if you hit 90% live outcome rate, you're essentially kind of categorized as a kill-free shelter, if you will, because there's always humane reasons, there's always other reasons. So for dogs, we're basically right there on the edge. When it comes to cats, in 2016, we were at about a 75% live outcome rate. We were able to get that up to about 81% for 2017. So we're making progress in that direction. A couple other notes, our community service worker situation, became unstabilized this year. Over the past month or so, and maybe it's due to the holidays, but it seems to have stabilized to some extent. We are getting workers anywhere from 2 to 4 or 5, almost on a daily basis now, so that's a definite help. And also, getting to your question, Mr. Shotwell, we are actually meeting with Cascades Humane Society, I believe tomorrow afternoon, and for about an hour to kind of discuss kind of what seems to be starting to show up in Jackson County, an animal welfare group going around providing straw. There's been WILX sometime over the weekend did a story on these two individuals, and one of those individuals was associated with the Veterans Day weekend site, which I might add, some mid-December, one of those dogs was reported stolen, interestingly enough. I've been trying to work with the police officer, provide her with the various phone numbers and the contact numbers, but unfortunately, that type of situation is kind of a low priority in the law enforcement field for an individual case like that. So. But continuing to work. Yep.
I was more concerned about the incident that occurred where the lady's dog.
Right.
That's the one that really worries me. She's afraid next to your house.
Yeah. Well, it was my understanding that went to the City of Jackson Prosecutor's Office, and I haven't heard anything since. If you have information to the contrary, I'd be more than happy to take it. And it could be. Again, it's all about the docket. Sometimes it's all about the dockets. So yeah, we are meeting with Cascades because they're a little concerned about perhaps outside animal welfare group coming into Jackson County using local residents. I'm a little concerned about that dog that was stolen, for instance, and that dog was stolen like 1 week after I had talked to the owner, and I'd actually gone out that weekend in November, and the dogs were legal. They, were not being neglected. Now I wouldn't keep my dog outside on a chain in a doghouse, but it's legal, and that's the bottom line. And I informed these local individuals that it was legal, and that dogs are considered property in Michigan. And then about 3 weeks later, this dog was reported stolen. So we have a little situation brewing, and that's about all I know at this point. Cascades is concerned, Dr. Anderson and I are concerned, and law enforcement at some point will probably become concerned too, if it continues on. There's good things to do and right ways to do it. So with that being said, that's my report. Are there any questions about 2017? And then we can talk about the Lenawee County situation as you wish.
You stepped right into it. Go for it.
Well, it's a very quickly evolving situation in Lenawee County, and we have 13 of those dogs. It's in the news. About 190 animals were located on this property. 35-ish were horses that were shipped off to other horse owners for shelter, protection, and welfare. And Dr. Anderson is involved in the situation in Lenawee County and acting as the forensic medical side of things. Lenawee County has animal control officers, but they don't have an animal control shelter. What they do is they contract with the Lenawee County Humane Society, which is a protection shelter for dogs and cats, if you will. So with that being said, capacity issues arose as they're trying to find not homes, but shelter, adequate shelter and care for all these dogs. And it was a breeding situation, a breeding operation of some sort, with cages stacked on top of cages. Like I say, the 13 dogs that we have are probably the worst of the worst, because Dr. Anderson's doing the forensic evaluations on them to create a documentation of the neglect and the bad condition, for law enforcement. And speaking of law enforcement, this is how quickly it's evolving. There's actually an arraignment for the owner on January 11th, which is Thursday. Yeah, Thursday. I mean, that's how quickly they're, working this through the system. Dr. Anderson came in yesterday and did the forensics on the animals. They definitely show signs of neglect. They are in significantly bad health. Again, these are the worst ones, mind you. She is working side by side with law enforcement, trying to provide solid evidence for the court case down in Lenawee County. With that being said, she's not acting as an agent of Jackson County. No, they don't have an animal, two different licenses, animal control license for shelter, and then Cascade Humane Society is an animal protection shelter. So the main difference between those two licenses is we have to accept stray dogs, they don't. That's the main difference. Yep. Humane Society. And so they contract out with the Lenawee County Humane Society to take dogs and cats to that the animal control officers find and deal with. Does that make sense?
Yeah, they just
contract out. Yeah, yes, they do. Well, they don't contract out the animal control officers, they only contract out the sheltering.
Oh, so they have an animal control officer.
Yes.
Staff who work.
Yes, yes. And that's who Dr. Anderson, Dave Portman, she's working closely with him, animal control officer, and Under Sheriff Bevier, Bevier, is the public information officer down there for this situation. So all staff, were informed last Friday to direct any calls to Under Sheriff Bevier. Request for, of the 13 dogs, we're pretty confident that owner sign-off is going to occur, and then Jackson County will own these 13 dogs, and we can rehabilitate them and then adopt them out. They're all small Shih Tzus and various other, breeds along those lines, about yay by yay dogs. Most of them were. Well, we were fairly low in census. This is kind of the lowest, right after the holidays is kind of the lowest time for everybody, if you will. So we were running about probably 65, 70% capacity. Now we're up to about 90-ish again. We have kind of cleared out a room in the back building in case we need to put them back there. I've kind of taken the chill off the room back there with a space, oil-filled radiator, electric heat. So if need be, we can still take in animals. Cascades Humane Society, I believe, took in about 20 to 30. Obviously, their census was down too. And so they're going in a lot of different directions. Yep. So that's what's going there. Like I say, it's a very evolving, quick-moving situation. That's my information at this point. Lenawee County is doing this pretty methodically, pretty smoothly, and pretty quickly, according to Dr. Anderson. They instituted the incident command system quite right from the get-go so that everybody knew who was reporting to who. The volunteers coming out of the woodwork were were able to be managed quickly and not gum up the works, rather, so that they could actually help. Any questions?
Anything else for Don? Anyway? That complete it for you?
Yep.
Very good reporting, thank you.
Thank you.
All right, committee, we, obviously Lifeways never showed up. We have received the Lifeways monthly report electronically. If anybody had any questions, they certainly can email the CEO, Mary Beth Leonard, or you can certainly email me. Other than that, we're going to move down to 5A. We'll need a motion support for the claims to the full board. All those in favor, so going to say an aye. Opposed, nay. Thank you. Other minutes? There is no other minutes. February reporting schedule. We have the Health Department, Lifeways, and Department of Aging. And now we're back to public comment. No public. Committee members' comments, or anybody here comments? Okay, hearing none, it is 12:47, and this meeting is called